Mr. Phineas, please, good evening once again.
Yes, good evening, Paul.
Please, how are you doing?
I'm very well, thank you. I hope you're also doing well.
I'm doing awesome. Thank you very much for making time to have this conversation with me. Kindly introduce yourself to the general public.
My name is PHINEHAS Kissiedu Ayeh. I'm the Executive Director for AP Plus Ghana, that's the current network of key populations living in the
Awesome. Let's dive quickly into it here. Kindly tell me, looking at the news flying about the 1,300 people tested for HIV out of 100,000 screened the security service, do you think that information was right or was even communicated well?
Right, thank you once again. I think that data is for public consumption, but not every type of data or kind of data that is for public consumption. Certain types of data are programmatic data. There are other types of data that, of course, are communicated generally to the public. But for this particular data, I felt like it was not for public consumption, and it was needless. There was no need of point communicating that data in the public domain. The reason I say this is that during security agency or security service recruitment, we always identify individuals who have one condition or the other, and we are supposed to emphasize confidentiality over health information. So people are going for security recruitment, and during the medical screening, they have been diagnosed with other conditions. What's the point putting that in the public domain? Does it mean that every institution, so for instance, let's say for a lot of the universities, before admitting students into their university, they screen them, and they definitely identify students who have other conditions, including HIV, and they don't publish their information.
Right.
The nursing training colleges, when they are recruiting students or admitting students, they also conduct medical screening, and definitely they will identify students or prospective students who have other medical conditions. Do they publish it? No, they don't do that. Why don't they do that? For purposes of confidentiality. So I'm surprised and scandalized to hear that the whole Interior Minister came to the public to disclose the number of people who actually tested during the security service recruitment medical screening. It is unwarranted and it is useless. And for me, my belief is that they strategically put out this data just to confirm their belief that these individuals have actually been disqualified. That's why they put the data out. Just to confirm the number of people who were disqualified, to justify the reasons why they disqualified people. So it is not right in any way as far as data protection is concerned, as far as confidentiality is concerned, as far as privacy is concerned. There's no point in actually disseminating or publishing that data in the public. It was needless, and we shouldn't have done that.
So looking at that, GAC, which is the Ghana AIDS Commission, also came out with a press release, and there's a portion that I want to read to you quickly so that I ask my question. From the 4th paragraph, they mentioned that they wish to clarify that under national HIV testing guideline, a single reactive HIV test result does not constitute a confirmed HIV diagnosis. An initial reactive result is primarily and must be followed by the national approved 3-test serial testing algorithm before an individual HIV status can be confirmed. It is therefore important that public communication accurately distinguishes between an initial reactive screening result and a confirmed HIV positive diagnosis. So with this statement here, they are talking about the 3-test thing. But from the information that we got, especially from the defense minister, he mentioned that with the military officers, and don't know about either the police and all other security agencies, if they all have their health screening at the hospital. Because looking at what he said the military officers always do their health screening at 37 hospitals, which we believe that their testing and everything will be confirmed there and there before they move to the next stage. So looking at GAC bringing this out, do you think that GAC was trying to cover up for the actual fact of how the security services screening procedures are and misinform the public?
Thank you for that question. First off, I wouldn't be able to say that GAC press release and for that matter, that particular statement was actually seeking to deceive the public. And let me confirm that the Ghana AIDS Commission is actually the body that is legally mandated manage our national HIV response. And when it comes to knowledge about our HIV protocols and policies, HIV is the custodian of that. However, that particular statement was a little problematic. The reason why I say this is that, of course, as an experienced HIV program mentor and advocate, I know that, of course, we have that national protocol for HIV testing, which is the 3-test algorithm. However, the 3-test algorithm is followed when you are using rapid testing. So when you use the first response testing, then you follow with the second response, or what we call the ORAPID, and then you confirm finally with an SD byline, which is the third test. You go through this protocol only when you are using rapid testing, or what we call point of care testing. However, when the test is being done in a laboratory, where, for instance, maybe the test is an antigen test, you don't need that 3-test algorithm, because the antigen test is able to, you are able to do it directly, because that one doesn't look for antibodies. Usually, the rapid test is used actually to check antibodies. So you have to conduct the 3-test algorithm to confirm that each of the tests is actually consistent with the other. Then you'll be able to confirm an individual as being positive. In my knowledge, the security services actually do or conduct their testing in the health facility, where they're able to do the antigen test. So when that happens, the individuals that were actually tested were actually confirmed positive. And within the security services, there are qualified health professionals who conduct these tests, so they know the protocol to follow before they can confirm someone as positive. So the information that the Interior Minister put out as having 1,300 people being HIV positive was consistent. I do not think that those were individuals who were not confirmed positive. They were actually confirmed positive individuals. So that is the clarity I want to give. That particular statement given by the Ghana Reference.
There's another aspect of the conversation that says, so now the 1,003 people, if they are being rejected, if for instance they are being rejected, is it going to be based on their HIV status? And if that happens, are we fueling stigma and discrimination again? Or there are other factors, that are going to be added to the fact that these people, aside their HIV status, there are other factors that are actually disqualifying these people. And there's another thing also, that if the 1,003 people are qualified to move to the next stage, would their HIV status prevent them from being recruited? And if it does, how are we going to handle this entire thing when it comes to stigma and discrimination from their family members, even from the people close to them, and even at the workplace?
So first off, let me say that the individuals that were disqualified, so to speak, or who were actually positive and facing disqualification from this recruitment, we only heard from the Interior Minister's remarks that we have not received any official communication from the Interior Ministry that individuals have been disqualified.
Okay.
In fact, the letter statement we received from the former defense minister, and this is a former defense minister who is not currently in government. So that is applied to the previous recruitment that individuals who were HIV positive were disqualified. But under this current administration, the Interior Minister only put this statement or made this statement that is not received any official confirmation from the Interior Ministry that indeed individuals, those 1,300 individuals who tested positive, have actually been disqualified. So we need to also demand for better and further particulars as to what has happened to these 1,300 individuals.
Exactly.
If they have been disqualified, the Interior Ministry, including the Defense Ministry, need to come out to confirm this information. Then we can actually take it from there. The other aspect of whether these individuals have been disqualified and what are the implications. This was also a general thing, so we won't be able to pinpoint the specific individuals who have been disqualified, because a lot of people were disqualified. From what we hear, this recruitment was actually looking at employing about 12,000, and the people who went through the medical screening were about 100,000. So of course we are certain that about 88,000 people would not make their way through the recruitment. So we have about 88,000 people who will not be employed. But the next question is, are these 1,300 people part of the 88,000 individuals who are participating? If that is the case, then it is not only the 1,300 people who are going to take it, but in fact the 88,000 people, all of them who were disqualified, are going to face it now, because now we don't know who among them is part of the 1,300.
Yeah.
You understand?
Yes. Yes.
So that is the issue. Now there's going to be a question of, hey, why were you disqualified?
Exactly.
Are you part of those who were HIV positive? And that is where we should be looking at it from.
Yeah.
All the 88,000 people who will be disqualified are at risk. You understand? They are going to take stigma from their families. They are going to take stigma from their friends. They are teachers. They are social partners. They are if they had school, if they are in school, they are school mates, they are work colleagues. They are going to take stigma from all these aspects. And then from the general public as well, as long as I know somebody who went to the treatment and was disqualified, that person is a potential HIV positive person working in my community.
Yeah.
So that's the implication. And then also the fact that even those who know that they were HIV positive industry, because of this backlash, because of all these media engagements and discussions around, these people are going to take and count stigma. And then it might be difficult for them to actually enroll on treatment. They want to hide as much as possible because there's no recruitment, medical screening, and then a data came out which you know you are part of, and it has become a public discussion. How will you feel? So that's actually going to affect these individuals specifically, as well as the greater number of people who are actually disqualified during this recruitment exercise.
To end this conversation, I would like you to tell us, what can you advise the general public to do in this moment, and also where we should tackle the conversation from, and how to support people and persons living with HIV, and how to respect confidentiality and also love them regardless of their status?
I want to tell the general public that HIV has been around for the past 40 years. HIV is happening. The fact is that at least 3 people test positive for HIV each week, every single week. About 3 people get infected. So HIV is not going anywhere because there's no cure. And as long as people are having unprotected sex, people are being exposed to other people's blood, people are giving birth without knowing their HIV status, definitely you will still have people living with HIV. So when the conversation around HIV comes up, we shouldn't make it look like as if some news has broke from the heaven. HIV has always been here since 1986. It's only 40 years now. What the public must know is that there has been a lot of advances. New technologies have actually been developed. There has been improvement in HIV management system. And in fact, people living with HIV are living healthy as long as they are on treatment. They are living healthy, and they are healthy as every other person who is not also living with HIV. So the public, that perception that we have about HIV and our stigmatizing attitude towards people who are HIV positive must change. In fact, today, technology has advanced to the point that people can take medication to prevent HIV infection, even when they have sex with somebody who has HIV. You can actually be HIV positive and be virally suppressed, have a sexual partner who is HIV negative, have unprotected sex with that sexual partner, and still not infect the person. There are HIV positive mothers who are giving birth to HIV negative children, and these children are private. This is the kind of information that the public needs to hear. This is the kind of information that the public must open their ears to listen and take interest, and not sit with 1986 information. That is what we need to know. The other thing also is that this whole issue, for me, is more of legal than social political discussion. Why I say this is because the state parliament has made laws in this country that is supposed to protect people living with HIV. And one of such laws is the Ghana AIDS Commission Act 1932. That law was enacted by Parliament of Ghana. So it's an act of parliament. An act of parliament surpasses every other legislative policy, whether security service recruitment policy or protocol or workplace policy or whatever policies that exist to guide the recruitment of employees in any institution. The Act of Parliament, which is the GAP Act 2016, Act 938, they can have all those policies. So if that particular law is saying that you cannot refuse to employ somebody on the basis of their HIV status, no institution whatsoever has that right to deny anybody employment on the basis of their HIV status. Now the point is that people are raising concerns about immunity, their immunity level, how strong they are, and the security training being very rigorous and a whole lot of things.
Yeah.
See, if you find out that somebody is HIV positive during the medical screening, the security services need to go a step further to conduct a CD4 count to check the person's immunity. If the person has a healthy immunity, then they should be able to go through the training without any challenges at all. Because if you are in the security services, you have continuous training. Sometimes they work for discipline, they work for other assignments. And there are people who are within the security service who are living with HIV. So the point is that if you are in the service and then you acquire HIV, that one, or you get infected with HIV, that one you are allowed to exist, you are allowed to continue working in the service. But if you are entering the service and you are HIV positive, then they don't allow you to enter it. It doesn't make any sense. So we need to go a step further. If you really want to protect people from discrimination and apply the laws of this country, but of course, once somebody is HIV positive, let's go a step further to check their immunity, check their CD4 count, check if they don't have any opportunity to test it. If you go that extra layer, add that extra layer and confirm that the individual is healthy and able to join the service, we give them an opportunity. But we shouldn't make a blanket provision or deny everybody who is HIV positive. You can find people who will be HIV positive, who got infected maybe like a month ago. It means that they have a very healthy immunity. Because the infection has not really advanced in their system. So once they are put on treatment to control the virus, their immunity is intact, their system is strong, they are fit, they can work. Because people, healthy individuals can live with HIV for 10 years before they start developing opportunities to infect. So we really need to apply the science and not use emotions and our own thinking that once somebody is HIV positive, the person must not qualify to be employed into the system. This thing has been going on for a long time. We have stories. We have people who have been disqualified solely on the basis of their HIV system. And those people are afraid. They don't know what to report these cases. So they just sit home and then they keep quiet. Ghana has advanced, we've gone forward, and we really need to be able to have this conversation and open the opportunity for people living with HIV to be able to have access to employment to be the security services. It's about serving our nation, it's about serving our country with dignity.
Yeah.
Not about one's HIV status.
Awesome. So PHINEHAS, thank you very much. I am so grateful for making time for this conversation, for us to get a little bit more clarity on the issue. And thank you very much for your input. And I'm sure in our subsequent conversations, we will still have you on board to, further how we can make life better for people living with HIV or any other person living with any form of condition. Thank you so much.
Thank you very much for having me. It's a pleasure talking to you.
So guys, we just spoke to Mr. PHINEHAS from KP Plus Ghana, and he has given us insight into the matter. And I believe with this you have some form of clarity, and we'll be speaking to more people and listening to their side of what they understand, what should be done, and together we can be able to fight the stigma around HIV and be able to pass on the right information when it comes to HIV related issues. So thank you for sticking and staying with me to the end. I will see you on the next one.
Still Human with Wajapol.